Well, hi everyone. I'm the director for Common Knowledge Trust. We're a New Zealand registered not for profit. And the mission statement of our trust is that you, our families, our societies, we can just use any and all healthcare and wellness systems and techniques as we suit without having to feel that we're doing one or another. Today I want to talk about post COVID brain fog. And this is where um, we have the ability to do things for ourselves. So, what I've learned over 50 years of being a naturopath and working with thousands of people is that since the since the late 70s, most of us are sort of focused on very strongly towards the doctors are going to fix this. I mean, when you think of it, there's good reason for that. My grandmother died of pneumonia when she was 39 prior to the advent of penicillin. I'm the first generation to have lived having access to penicillin. Um, our Trust Common Knowledge holds all the skills hundreds of fathers and mothers developed around childbirth and pregnancy in the early 1970s when cesareans were major abdominal surgery and 95% of us labored because risks were considered to be natural, normal, physiological, and tragedies were tragedies, but they were accepted because the medical profession wasn't sophisticated enough. I mean, just consider that. When I gave birth in 1970, there were x-rays. There were no ultrasounds. There were no CT scans. There were no MRIs. There were no PET scans. I grew up during the polio epidemic. It took years and years and years for a polio vaccine to be developed. And the first group, I was included in that, a good percent of us got polio from the vaccine because it was a live vaccine. Think of the vaccines today for COVID. Some of them are RNA recombinant. That means they're clipping a piece of the vaccine and clipping a piece of the virus and then replicating that into a vaccine. We didn't know in the 1950s that penicillin and other antibiotics would create antibiotic-resistant bacteria. We had no idea. And now they're using viruses to combat that. We have no idea what the vaccines today are going to do 50 years from now. We have no idea. I got COVID in March of 2020, and I used a protocol, which is on the first and second video of this series, and I continued to use it because I had symptoms that lingered. I have a genetic metabolic disorder, which means my immune system has difficulty, and I continued to feel poorly. I also was doing a lot of research, although I'm a poor researcher, I'm a more trivia researcher, and it became obvious very early that COVID was not just a respiratory disorder, but it was a blood vessel disorder, often leaving micro blood clots throughout people's bodies, or these white mesh spider webs in our lungs. So I became fascinated with what we could do. I have no medical training, never wanted to have any. I'm not licensed to prescribe, diagnose, or treat. I work with wellness. I work with natural health. I don't use traditional health care, some Chinese medicine and stuff like that, homeopathics, breathing, and all sorts of things. So this issue on the long haul symptoms about brain fog, I want to talk about today because what I've noticed with a lot of comments is that it seems as though people have a personal belief that before COVID, they were in sort of perfect wellness and that COVID has made them unwell for almost like the first time in their lives. One of the things I've talked about in the videos is that our minds, our emotions, and our bodies are we. So when I read about people being sick of this and angry, that's talking to yourself. That's how you're talking to yourself. And I used to do that way back in the 20s. I'm now in my almost 80. And I learned that I can't talk to myself that way. I have to use my mind to help my body, and more so with COVID. This is new in our body, and so we have to use our mind to investigate how we can help ourselves, our mind, our emotions, and our body. And when we have brain fog, most of us experience brain fog throughout our lives. I mean, if you're taking any medications at all, I mean, it's just recently that they've begun to realize that medications have counter effects on each other, and then you get more medications to counter the effects that the medications occur. Many people that I work with who take medications have brain fog just from the medications. That doesn't mean you should stop taking the medications. It means you should recognize that that's part of what is part of one of the side effects. Stress, when we're feeling overwhelmed because our central nervous system, our sympathetic nervous system, gets stimulated and we feel overwhelmed. So the sympathetic nervous system is fright, flight, fight, freeze, and just curl up in a ball. So when we do that, we're highly focused on one thing at a time, but we can't have a bigger picture. So we can have brain fog due to that. Hormones, menopause or menstrual periods, pregnancy, birth, parenting. We all have brain fog. Autoimmune diseases, which many of us have. Dementias. I'm getting older. I lose parts of my brain. Toxins. And that's sort of what I want to talk about a little bit today. This virus is new to our body. It's as simple as that. And when we were in acute phase, our immune system was kicked into overdrive. And the medical profession was telling us if you get, people who get really, really sick have this cytokine response. And that means the immune system has worked really, really hard, and then the immune system really can't work any harder. And we just get this storm that goes through our body. And it's very, very difficult and challenging to deal with. And the Chinese learned very early on. I mean, the first fever hospitals were developed in February. And I was doing research in January from New Zealand. And the fever hospitals were developed because the Chinese realized that you had to treat people very early in this disease. And that's why we put out the protocol in the first and second videos of this series. And I developed it because I got COVID and I needed to take care of myself. And the governments were saying to us, if you feel sick, go home. Basically isolate and do nothing. They didn't have anything. And when we're in long haul now, our doctors don't know. So our trust that believes you should use any and all health and wellness, we also believe in every little bit helps, and little by little, which means that if you use things of wellness for yourself, tell your physician about it, because we need to grow a community understanding of how to be dealing with this disorder. So when we have a lot of toxins in our body, or we feel that in our brain. It's not that we have brain fog. It's not that our brain is separate from our body. Our brain is aware of the junk in our body, and that produces brain fog. We also have so much fear right now. I mean, it's just so much fear right now. And when the sympathetic nervous system gets stimulated, it closes down our cardiovascular system, and it causes our blood pressure to go up. It closes down the alveoli in our lungs. It closes down the arteries in our heart as well. And when we are in high stress, which a lot of long haul people are talking about, we're concentrated on this one thing. So we don't have any energy or space in our mind because we are so focused. And right now, a lot of what I'm reading in long haul is just so much anger to ourselves and disappointment. I felt well today. Now I feel poorly the next day. When am I ever going to get over this? We have to work at this. This is not something that our doctors at the moment can fix. They can't fix this. And you can wait for them to fix it. You can do nothing. Or you can begin to self-care. And when you self-care, it's going to be a multi-pronged ability. What's the advantage of us now? It's called the internet. You can go into YouTube and find wonderful brainwaves that calm you down. I'm not a great researcher. I'm what's called trivia researcher. So I'll go into Google and I'll say, brainwaves that calm me down. And they'll have links. I'll do that in YouTube. They'll have links. So it's really important for you to want to self-care and for you to understand that it's going to take time for your body to throw off the residuals of this virus, or if it has left damage, to begin to heal that. If it's a blood vessel disease, which they think it is, it's damaging the endothelial cells in our blood vessels. I didn't know what an endothelial cell was until I got diagnosed a few years ago with a genetic metabolic disorder because I had bypass surgery without a heart attack. And the surgeon said to me, those blockages have been there 50 years. Your heart's incredibly healthy. You'll never have a heart attack. And I asked him why, and he said genetics. And I thought, well, that was a throwaway line. But it turned out I had very high homocysteine. I didn't know what homocysteine was. It's a stress hormone like C-reactive protein. I don't have high C-reactive protein, but the homocysteine damages the endothelial cells, and the low-density lipids stick to it. So I've had to do things to try to lower the homocysteine. And if this is a blood vessel disease, which is damaging the endothelial cells, then you start to look and research through Google what natural remedies or what supplements can be used to repair the endothelial cells. And Linus Pauling, who is just well known, Pauling, he did heaps of research about it. A lot of vitamin C, arginine, which is an amino acid, and lysine, which is an amino acid. I take something else to reduce the homocysteine. I also take serrapeptase. There's nattokinase and serrapeptase, soybean proteolytic enzymes. I wouldn't have known what they were if they slapped me across the face a few years ago. But the nattokinase can break down blood clots, and the serrapeptase can break down the arterial sclerosis, the fibrin. But you have to take it over a long period of time. Do I know what's happening in my body? No. Do I get tested periodically? Yes. So if my homocysteine comes down, there's going to be less damage in my body. Or if my lipids come down, do I know what's happening in my cardiovascular system? No, not really. So there's an element of doing things that we don't actually know what the results are going to be. But years ago, after the surgery, when the surgeon said to me, you've just basically had a lifestyle operation, to which I thought, God damn, I had cosmetic surgery on my heart. What's that all about? Well, my biggest health symptom, really, other than the fact that I had this genetic metabolic disorder, which meant it didn't matter what I ate, I was still damaging my heart because I couldn't metabolize out, and still can't metabolize out, B vitamins. It's not an uncommon disorder, but it is what it is, and you might not have that. It's just one of those things. So anyway, my issue was that I'm athletic, and I could go a pace forever, whether biking or jogging. I could go forever. But if I started to go up hills or go faster, my breathing would shift from nose, belly breathing to chaotic instantaneously. I mean, faster than you could snap your finger. So I thought, okay, this surgeon has said there's going to be a lifestyle operation. And so I'm going to think clearer because I've always had a learning difficulty. And I'm going to breathe better. Neither of those things improved, right? So then I Googled, what do middle distance runners sound like when they're breathing? Because I, as a naturopath, work with people with disabilities, athletic performance, athletic injuries, pregnancy, childbirth, all sorts of things. And we don't work to cure things. We work to reduce the intensity of the episodes, of the symptoms, to decrease the length of the episodes of the symptoms and increase the space in between. And that we can do very well with self-help because we pay attention and we begin to understand these things over time. And when I worked with runners, I'd say to them, how do you breathe? And they'd say, we don't pay attention to our breathing. I paid attention to every breath in and every breath out, but I was a nose, belly breather. So I became a Buteyko instructor, Buteyko. James Nestor, as you'll read in this, was an investigative journalist, and he's just written this book called Breath. And he's gone around and researched all sorts of breathing methods, which have been around throughout the world in almost every culture. And somebody has said to him, lots of people have said to him, what's the ones that work best? And he goes, they all work fine for their purpose. So Buteyko was a Russian doctor who was dealing with people who were had breathlessness. I didn't think I had breathlessness until I started becoming an instructor, and I realized that I was always breathless. I was lying down and being breathless. I was sitting up and being breathless. I just didn't recognize it. But what Buteyko did was allowed me to change the breathing center in my brain by increasing my carbon dioxide tolerance and increasing the production of nitric oxide in my system. I had heard about nitric oxide because Michael Morsley, who's a British investigative journalist and a doctor, did this program called Trust Me, I'm Your Doctor on BBC. And he was dealing with skin cancer and vitamin D and sunscreen and eating vitamin D. And the woman doctor who was doing this went to a doctor who had a human skin cell, and he's shown sun on it, and he said, look at that layer underneath. That's just bright white. That's a production of nitric oxide. It vasodilates. And so how does this have to do with brain fog? Because when we're as stressed as we are as COVID long haul people, most of us, I can tell you right now, I don't even know you, and I know your mouth breathing. I know you're breathing too fast. I know you're stimulating your sympathetic nervous system because we're all so stressed, okay? But when we stimulate our sympathetic nervous system, our 100,000 miles of blood vessels, which if they've been damaged through COVID, if the endothelial cells have been damaged, they all just shut down because the sympathetic nervous system is fright, flight, fight, and freeze, and narrow focus. So we have brain fog just because we're stressed, because we're so overwhelmed by COVID, and the medical profession can't do anything about it. And in some ways, the natural health stuff, it goes around and says, this can cure it, this can eliminate it. No, it can't. Natural health is about self-help. It's about reducing the intensity of the symptom episodes, decreasing the length of them, and increasing the space in between. That's what life is. It goes more like this rather than like this, right? We don't want to do that. We're dead. So we want to do this. We want to decrease the intensity. We want to decrease the length, and we want to increase the space between so that we have a nice flow of our energy, physically, emotionally, mentally. So much of our brain fog comes from, if you have an autoimmune disease, if you're taking lots of drugs and stuff, and you have dementia, and you're pregnant, you're being a parent, you have work, you don't feel well, no wonder you feel brain fog. So the question is how do we deal with the brain fog? Well, Google brainwaves and calm down. They have 8-hour tapes of this stuff. You can play it at night. I used homeopathics. You can Google homeopathic remedies for brain fog. But with homeopathics, try to be as specific as you possibly can. So when you're talking about homeopathics, you can do homeopathic remedies for brain fog. But when you see those remedies, they're going to have things like people who can't concentrate, or people who your brain feels tired, or I have problems collecting my thoughts. So you want to be self-knowledgeable about what your general term brain fog actually means, and then pick a homeopathic remedy for yourself. You can use them together. There are very few counterindications, and you suck them. Why do you put them in your mouth and leave them there? because we have these proprioceptive cells here in our genitals, in our toes, elbows, and they translate the world to us. So if we put something in our mouth that doesn't taste right, we're sensible to spit it out. If we don't catch that and it goes into our stomach and we feel nauseous, it's better to vomit it out. And sometimes we have diarrhea or we just feel crappy for days while it's trying to metabolize out of us and our body's working overtime. And then we feel brain fog when that happens. So we put homeopathics in our mouth because my trivia research years and years ago was that these proprioceptive cells, the message goes to the brain with 1/1500th of a second. That's really rapid. So homeopathics are very specific. And what you want to do is, if you feel you can't collect your thoughts and you find a remedy for you, and you can, most countries you can buy them in health stores or online or on Amazon, and most of the remedies are quite common. And then if you're feeling that particular symptom, that's an episode. So just put it in there and notice in 20 minutes if you feel better. Natural health is about us noticing for ourselves rather than feeling, I want them to fix it, right? So if you feel better, then that's good remedy for you. You may then discover another symptom which is either covered by that remedy or needs another remedy, in which you can then separate them. So when I have brain fog, I have a number of different types of brain fog. Sometimes I can't collect my thoughts, right? With a learning difficulty, that can be really challenging, right? Sometimes my brain just feels tired. So I recognize them as different and I deal with them in a different manner. There are also wonderful herbal combinations for the mind, wonderful herbal combinations for the mind. They're both Western herbal combinations, and there's Chinese medicine, which is absolutely brilliant. So just Google herbs for mental clarity or something like that. Or herbs for, stress is one thing, and brain fog comes from stress. So if you want to deal with your brain fog dealing with stress, then Google best herbs for stress. But if it's brain fog and you feel that the brain fog is causing the stress, then you Google herbs for mental clarity. And when you get herbs, try to get them in capsule form and then make them as a tea, because you want to use those proprioceptive 1/1500th of a second to your brain and to get that information. When we don't use that proprioceptiveness in our mouth and we take tablets or medicines, it has to go through our digestive system. And our digestive system is very, very complex. So if we're trying to do something to alter an episode or a symptom right away, we want it to go from our mouth to our brain and give it that information. So I'm going to post a description on the YouTube channel. There's a part of me when I read in the COVID Facebook groups, this desire to form groups that have specific episodes or symptoms, and then sort of collectively work together around those things in an informal manner, and then spread that information out. I had a belief from January of 2020 that from all the research, the medical profession was not going to sort this out quickly. That left it to us individually. But it's a collective thing as well. So as we learn more, and as we take care of ourselves more, as we have more successes. So for instance, if I'm using a homeopathic remedy for my brain fog, and I say to somebody, I've used this, and they come back and say, I used it as well, and I had good results. Wonderful. If someone comes back and says, it didn't work for me, then what we want to do is explore what might work. In other words, instead of arguing the right or wrong of something, we explore, we refine, and we go out further, because there is no one size that fits all. There is no one thing that is going to sort this out. There is going to be multiple things. And part of that multiple things is because we have specific symptoms that we're identifying in general terms. So when people say brain fog, it can be I can't collect my thoughts in brain fog, or my brain feels tired in brain fog. So I can't concentrate in brain fog, which means we're trying to treat individual symptoms within a collective. Now, going back to the sympathetic nervous system, there's another nervous system. It's called the parasympathetic nervous system. When our sympathetic nervous system shuts down our cardiovascular system because we're in fight, flight, that means we're trying to move very quickly to get away from something very rapidly. But we sustain that for a long period of time. And why do we sustain it? The same reason the tabloid news is such a big thing on cable TV and in newsprint, because our bodies like sensationalism. We are addicted to intense feelings. We would prefer to be stimulated than to be calm, honestly. And it's gotten worse as I've gotten older with social media out there. It's called social media, but that's not how people are using it socially, is it? They rant at each other, they rail at each other, they spread misinformation, disinformation, they diss each other, they do all sorts of things. That's all sympathetic nervous system in full-fledged, because people who created tabloid knew that if you could incite these primitive emotions down here, the fears, the hatreds, the angers, that they could sell sensationalism. In the COVID long haul groups at the moment, what I hear a lot of people doing is expressing how uncomfortable they are, which is, at least they have a platform for that. But then the responses tend to be, I'm sorry for you. So we actually aren't using it as a creative tool for us individually, our family, our friends, our society, our globe, to learn more about how to self-care. When I self-care and I give that information to my doctor, sometimes the doctor rolls their eyes, but sometimes the doctor goes, thank you for sharing that. I have another client I might pass that on to. Or they, as a person, might expand how they're doing it. And why do they do this? Because when I was young, if you had diabetes or a heart problem or obesity or anything like that, the medical profession 30 years ago was saying diet, exercise, and stress reduction has nothing to do with those diseases. Take these pills. They've matured. They know that if you have these issues, diet, exercise, and reducing your stress are very important, and they'll tell you that. We have to participate in our own wellness. Part of that is stimulating, learning how to activate our parasympathetic nervous system. Because I had high homocysteine, mentally I am not a nervous person, but because this stress hormone was in my body, because I don't metabolize B vitamins, my body function was stressed, and that caused damage to my arteries. So we can have body stress, we can have mind stress, or they can do both. So the parasympathetic nervous system, we don't live in very much. Most of us experience it when we go out into the sun and we get sleepy. That's our parasympathetic nervous system. It is our calmness. It's our calmness. When we are calm, then what that does is that dilates our 100,000 miles of blood vessels. That opens up the alveoli in our lungs, the arteries in our heart, and the arteries that go to the brain. But it's more than that. We have to develop carbon dioxide tolerance. COVID has focused on oxygen saturation. It has not focused at all on carbon dioxide tolerance. What's carbon dioxide tolerance? On the extreme end, a free diver, person who goes down in the water and they can hold their breath for 6 to 10 minutes. That's carbon dioxide tolerance. The Kenyan runners that came into the Olympics in, I think, the 70s or 80s and just left everybody behind, they have high carbon dioxide tolerance because they live at high altitude. When people are breathless, they don't have good carbon dioxide tolerance. And how do we know this from personal, not necessarily experience, but personal stuff? If you get whopped in the side of the head and stop breathing, you can go, as an adult, between 4 and 5 minutes without breathing, no oxygen. You have enough oxygen in your body to not damage your brain. A newborn, because I've worked with pregnancy and childbirth for 50 years, and my trivia research, babies in utero have what's called fetal hemoglobin, 2 oxygen molecules attached to the hemoglobin. And at birth, it changes to adult, 1 oxygen per hemoglobin, red blood cell. Okay? And it is the high carbon dioxide tolerance that causes them to want to take their first breath. And babies up till 6 months of age are only nose breathers and belly breathers. They can't breathe through their mouth. That's why you can swim them, put them in the water, because they stop breathing. They just close off their nose. And they have high carbon dioxide tolerance. Carbon dioxide tolerance can be created. And it's done through exhale breath holds, not inhale breath holds. And that's why I studied Buteco, and then Oxygen Advantage, which was for athletes. As I said, James Nestor's book, and this is, honestly, I haven't read it, but I've listened to him talk. Go to YouTube, you can hear him talk. Okay, so Buteco is actually a life-changing breathing technique. You change your breathing. It takes time. Well worth the energy and effort. It takes time. And it can be really a bit unnerving, because I discovered that all of my breathing was dysfunctional, and all of us breathe in and breathe out all the time. So changing it is really, really challenging. So you want to have a greater carbon dioxide tolerance, because when you do, the carbon dioxide does something to the oxygen that's sitting on your red blood cells. It detaches it. And what does it do with it? It puts it out into our organs, including our heart, all of our organs, and all through this 100,000 miles of now opened blood vessels, so that it gets used by our tissue and our organs. And that's why athletes who have good carbon dioxide tolerance and are not breathless don't have as much fatigue, because their carbon dioxide is disassociating the oxygen, and their body's actually using the oxygen more. And that's good. They don't get as much lactic acid. So when you develop a higher carbon dioxide tolerance, you are opening up this parasympathetic nervous system. You're becoming calmer, because the parasympathetic nervous system has the ability to have a large vision, which obviously then impacts our ability of our brain to see big picture stuff, small picture stuff, and also to be problem solvers. So most COVID long-haul people are very narrow focused. But there's another gas in our body. That's the nitric oxide. That's the one that's under the skin, the sleepiness when we go into the sun. That is one of the best vasodilators. And it dilates all the way up to our fingertips. So when our nitric oxide is circulating through our body, our fingers are warm, our hands are warm, our feet are warm, our chest gets warm. And often we feel a tingling in our sinuses, because besides under the skin, this is where it collects. And we can grow that nitric oxide more by humming. Now, some people hum here, but you want to hum up here. And you do that just by putting your tongue to the roof of your mouth. So you're humming here. And you want to feel that vibration. And then you want to exhale, hum, as long as you're comfortable, and then inhale through your nose and draw that nitric oxide in. How long do you do it? Until you're comfortable. There's lots of YouTubes about nitric oxide and humming. Go research it. Be a trivia researcher like me. So, brain fog. Why is it important for us as long haulers to deal with this? It's important because we have to have a bigger picture. We need to be doing things that stimulate our parasympathetic nervous system. and use the sympathetic nervous system like I did when my body was in the acute phase. I can still try to activate the parasympathetic nervous system, try to be as calm as possible. But I also have to recognize my body needs to be working to, to deal with this virus. But once we get into this chronic phase, we want to dampen down the sympathetic nervous system and learn skills to create a better, more aware parasympathetic nervous system response, a calmer response, because it is in the calmness that we really, truly can reduce the episodes of the symptoms and the intensity and decrease the length of them and increase the space in between and feel that our life is doing this more. Now, I do have good news. The good news is I believe, even though COVID has been absolutely globally tragic, and it's not going to go away, these variants are going to be a thing. And so I do my trivia research about them. However, all of us who've experienced COVID and who survived, and even those of us who are long haul, I believe that when we investigate and care for ourselves and learn skills and we pass them on to other people and we refine them and we pay attention, that we broaden ourselves, we deepen ourselves, we become fuller, more engaged people. And that's very good because our modern world, particularly since the 80s, the 90s, and with social media out there, we have become incredibly narrow visioned. And we need to become very broad visioned and yet be able to work on a micro level. So we need to balance the micro and the macro. Now, do I have a passion for this? I have a passion for skills. I don't care how anybody has their baby, but I've spent 50 years passing on skills that fathers and mothers developed because I believe everybody should be skilled to birth their baby no matter what. Do I care about skills about COVID? Yes, because I had COVID and I have had long haul symptoms. But you want to know what my political passion is? Plastics. So, if you feel there are too many plastics in the world, then we need to really, really do something about it. We need to do something about it now locally and globally. That's my passion. What are the skills that we can use that really reduce the plastics on land and in our water? I don't know, but that's really, really where my sympathetic nervous system gets really activated. So I have to use my parasympathetic nervous system to try to figure out how to do those things. Anyway, thanks for listening to me, and all the best to you in your journey through this amazing, amazing period of time.